Cropper's Nogales Auto Center, your local dealer of Chevy, Buick, and GMC. The best place to find the newest, award-winning Chevy, Buick, and GMC models. But there's more. Cropper's also provides professional certified service, parts, and a full-service body shop and collision center. Come on over and see for yourself everything Cropper's has to offer. Located at 1831 North Grand Avenue, Nogales, Arizona. www.croppercare.com, 520-762-6446. Buenas tardes, Nogalenses. So we're here on En Línea. It's a little bit different than usual. We're doing it on a Wednesday, and we aren't going to be doing quite the same format. It's been a very, very, very busy week, and we got a lot of things going on. Las Fiestas de Mayo, Beyond the Wall. On Sunday, it's a lot of things going on this week. So we've mixed some things around, and we're doing things a little bit different this week. But thank you guys for coming. Aquí tenemos Dr. Pareda de Mariposa and Dr. Woodward de Mariposa. How are you guys doing?
Great. Thank you, Joe. Thank you for inviting us to spend time with you and talk to the community. Appreciate it.
Oh, I appreciate you guys coming out.
Thank you.
Really, really appreciate it. So let's talk about what are we here to talk about?
Sure. So first of all, thank you for inviting us. This is our second time on Facebook Live, and it's a great opportunity to show what we do and work with the community to enhance access to care. Just a brief announcement. Dr. Woodard is on call today, so if she gets a phone call, she'll have to depart, and then we'll do it some other time. But we're here to talk about OBGYN services. This is something we've been doing for a long time. It's a very important piece of what we do in terms of access to prenatal care and have good outcomes. We'll talk about the obstetric services, GYN services, and if we have time, we can talk about issues related to breast diseases, maybe contraception. So I think we're here to talk about whatever you want to talk about. The expert is to my right, so I'll play a fairly small role in this. I'll be happy to answer any questions regarding the big picture of Mariposa, but I think Dr. Woodard will be our main host. Thank you.
Bien. Sounds good. Thank you guys so much. All right, so introductions. Let's let us know who you are.
Okay, me llamo Crystalline Woodard. Vengo de Cincinnati, Ohio, pero nací, también vengo de San Diego, California. Mi familia es de México, del lado de mi mamá, y también tengo el lado de mi papá, están en el East Coast, como North Carolina y todo.
Muy bien.
So, aquí estoy, cerca de California, pero también me gusta vivir aquí. Prefiero vivir aquí.
¿Te encantas Nogales, entonces?
Me encanta Nogales, me encanta esta área, me encanta la comunidad, todos los pacientes.
Qué bien, qué bien. Muy bien, pues empezamos, ¿no? Let's jump right into it.
Okay.
So let's talk about OBGYN services, Mariposa, what you guys do, the services you guys offer. I mean, starting with obstetrics.
Okay. Well, obstetrics.
Obstetrics.
Yeah, obstetrics. No, it's okay. It's okay. It's cuando cuidamos las mamás. Okay, we take care of all the pregnant ladies, and we like to see them as soon as you know you're pregnant. We want people to show up, make sure they're getting the care that they need, getting the tests that they need at the beginning of pregnancy, get ultrasounds to make sure that the dates of conception, are all in agreement, and to kind of make sure that they're getting on the right track for a healthy pregnancy. And that includes getting multivitamins, which we provide for the first prenatal intake visit. We also do ultrasounds, like I said before, and we just make sure that we have the healthiest pregnancy possible. So.
Very, very cool. Awesome. Now, if we're going on the OB segment first. We can jump right into contraception. I mean, and talk about different things that have to do with obstetrics. Sorry. So contraception that you mentioned. What kind of contraception services do you guys offer?
Well, anticonceptivos or contraception is a big topic, and whenever I see a patient, I just start off by saying, okay, what do you know? What do you know about contraception? I have different sort of categories for contraception. Al principio tienes una pastilla que tienes que tomar cada día, okay? So you have to be really good about it, right? That's a daily thing you have to remember.
I've seen the commercials.
Yeah. tenemos algo que es bueno por una semana. It's like you have a patch. También hay un ring que se pone en la vagina, and you have to change that out every week, okay? And tenemos un shot. Se llama Depo-Provera. Y esa inyección es bueno por 3 meses. So you have to just remember to come in every 3 months for birth control. And then after that, you have something that lasts for years. Tenemos métodos que son buenos por 3 años hasta 10 años. Okay.
Wow.
Y los métodos dependen en su salud. Okay, so if you're a really healthy person, or if you're an unhealthy person, it changes what's the best thing to do. If you have any other problems like irregular bleeding, any other concerns, we can adjust birth control options to sort of suit the needs of our patients. And even the pill itself, there's more than 20, 30 different formulations of la pastilla. There's so many different types. So we can always say, hey, I have really bad acne. So if you have bad acne, we can pick a pill that's going to help with your acne.
Nice.
Yeah. If you have really painful periods and you get kind of moody, we can have another pill that can help with that. So hay muchas opciones.
There's a pill for that.
And then lastly, if someone knows that they're done having children and they want something that's permanent, it's not reversible, obviously, is tubals. We do bilateral tubal ligations, or ligado de trompas también se llama, and we do them in Green Valley Hospital there. So we do offer sort of every form of contraception, from just daily to lifelong. So.
Now, one of the things that we would need to really, really get into is the conversation that you have with the patients, because, it's not a comfortable conversation for everyone, obviously. And I'm sure you've had patients who come in or are afraid to come in, and they come in maybe a little too late to talk about this, things like that. So, let's talk about the first visit. At what age should a patient first come in, and how does that conversation go?
So for someone who has no medical issues, so we're excluding pediatric problems, for example. So someone who's sexually active should come in for an exam. Okay. And if they don't feel comfortable with an exam, at least testing for sexually transmitted infections. Las infecciones sexuales son muy común aquí. Specifically, chlamydia es muy común aquí. Y es muy importante hacer una prueba para estar seguro que no tienes la infección y para hacer un tratamiento. Because if you let it go for too long, it can cause problems with infertility and pain. And so I think that's really important. So when someone's sexually active. Also, if someone's having periods, unrelated, obviously, to their sexual activity, but they're having heavy, painful periods and they're young, I do recommend they come in, because that's not something you want to suffer through. Especially los jóvenes que están en la escuela, es difícil de estudiar si tienen mucho dolor, si tienen mucho sangrado, si son muy débil, si tienen anemia. So they should come in and see me, or any other physician at Mariposa and OBGYN services to help with that, to help treat that.
And how do you, for a young woman who's coming in and is either sexually active for the first time or experiencing this for the first time, what is the process to make them ease into it, to make them feel comfortable? And their families too, because obviously their families are going to feel very uncomfortable if they just found out that their daughter is sexually active for the first time.
Yeah, it's hard, it's awkward. I think it's really great when the parents are involved and they have a relationship with their child and they have a conversation. I think the best interactions I've ever had with patients who come in at a young age are when the parents are saying, hey, I have my daughter here, she's sexually active, we need to have a conversation about how to keep her safe, how we initiate birth control so that she can continue on with her plans and not interrupt her schooling, not interrupt the things that she wants to do with a pregnancy that's unintended. So I think it's just sort of having very open parents can be very helpful, and it's hard. Everyone's awkward. The first visit's always a little awkward for everybody. But sometimes I don't even do an exam the first visit. Sometimes it's just talking, and I don't like to push anyone into something that they don't feel comfortable with. I just kind of like step by step making sure that we're kind of addressing the needs of the patients, especially when they're young. So yeah.
Just a brief comment, Joe. You just want to talk about pregnancy and STIs, or, pregnancy prevention is not the same as STI prevention.
Yes, of course.
So that's really important. El embarazo es muy distinto que las infecciones transmitidas sexualmente, y las dos requieren un
Tratamiento
distinto. So, el hecho de que están tomando pastillas anticonceptivas no quiere decir que están evitando las enfermedades que la doctora habló, de gonorrea, clamidia, HIV.
Y
hepatitis
pues
C.
me imagino que, como dijiste, es que clamidia es uno es lo más común aquí, que a lo mejor es por la que la gente no entiende que los contraceptivos anticonceptivos son.
So, la cosa con clamidia es que unos no tienen síntomas hasta que está más avanzado y la infección se pone más serio. A veces los únicos síntomas es como sangrado irregular. A veces no hay ningún síntoma.
Ni sabes entonces.
Ni sabes. Hasta que se pone más fuerte, se entra en el pelvis y puede uno ponerse muy, muy enfermos. También la prueba que nosotros hacemos es una prueba del orín o también de un swab vaginal. Okay. Y otra prueba que se puede hacer es de sangre. Y de sangre no es muy seguro para saber si uno tiene clamidia. La prueba de la sangre, unos piensan, mira, la prueba de la sangre es más seguro, pero en realidad no. Lo que pasa es que la clamidia usualmente se queda ahí en la vagina, en el cuello de la matriz, y no es algo que entra al bloodstream. Ajá. Y cuando está en el bloodstream es que dice que uno está bien enfermo. Sí. Okay. Sí. No queremos esperar hasta que está en el bloodstream. No. Okay. Y a unos estamos cerca a la línea. Okay. Puede cruzar e ir a México, es muy fácil. Ir a México, sacar la sangre. Ay, no tengo clamidia, pero vienen aquí. Y si tienen, y están muy confundidos todos. So yo recomiendo that we give you a swab, así un swab, para saber si está seguro. Y lo que pienso es que I think people go across the line, do testing, they think they're okay, and they don't realize that they still have chlamydia. No piensan que lo tienen. So I think it's really important que vienes a visitar con un doctor. Claro. Talk to a doctor. Make sure you're getting the right testing done to make sure that you don't have it, and that when you do get treated, that you're clear from it. So.
Pues algo que muy importante que me está curando la mente ahorita. Pues es una comunidad muy chica, ¿no? Uh-huh. Y mucha gente tiene vergüenza. Por la vergüenza, no vayan por la vergüenza, o que no, pues ahí se va a ver su tía o su prima ahí en el waiting room, ¿no? Uh-huh. Y les da vergüenza ir al doctor. Uh-huh. I think it's important to let the community know, pues, que es que todo confidencial.
Mm-hmm. Everything's confidential.
Que nadie, no sabes quién vino a la clínica el otro día.
No, it's all very confidential. We're very, very careful about keeping everything private. My family members go to Mariposa. I cannot view their charts. I cannot even view my children's charts. So if I want to know information about my child, I have to call. Wow. I have to speak to the nurse or the doctor.
I'd be like, that's why I would want to work at Mariposa. I'm just kidding.
I have to ask them and say, okay, how did that test come back? I have the ability to ask because I'm their parent and guardian.
Of course.
But it's not something that I can just look up.
There's no special privileges because you work there.
No.
So this is something we take very seriously.
Absolutely.
The privacy and confidentiality laws are federal laws. And it's even more important in small towns.
Of course.
For us to be efficient, for us to be credible, we take this very, very seriously. We work at it day in and day out. And I thank you for bringing this up because it gives us an opportunity to reassure the community that we take this very, very seriously.
Well, having grown up here and knowing a lot how the community is, I imagine that there's a lot of situations where people wait till the last minute because of that, because they're maybe not necessarily embarrassed, but they're afraid of who's going to see them there and what they're going to hear from the rumors that are going to start, El chisme, pues.
Well, I don't think people should be embarrassed to see their OBGYN. There's also many reasons to go see your OBGYN that aren't related to anything anyone should consider embarrassing. I still think that if you are sexually active, if you have concern about sexually transmitted infections, it's a very important reason to come. But there are also reasons that have nothing to do with that. Irregular bleeding, coming for your annual pap, your annual exam and pap smear to make sure everything is okay. just making sure that you have a healthy life is really important. And so we address lots of things, not just things that people, I guess, would be embarrassed about.
Of course.
So I think it's really important that people just, it's no one else's business, and we don't share it with anybody else, and you should come and get seen as if you need to be seen. So.
Right. Yeah, and I think Dr. Witter said very well. It's about prevention. It's about early diagnosis and prevention. So there are specific guidelines that we follow to do that, whether it's a swab or urine or a blood test. And if we diagnose it early, we'll be able to treat it. One thing about STIs, by the way, is that when we diagnose one, we try to diagnose a possibility of others. So we look at chlamydia, we look at gonorrhea, but we also test for other things depending on the situation. We check for a blood test for HIV. We may choose to check for syphilis or hepatitis B or hepatitis C. So it's not just about diagnosing chlamydia, which is great.
About covering all bases.
It's about, absolutely. And then we also take the opportunity to talk about HPV, which is the most common cause of cancer of the cervix. We're very fortunate we have a great vaccine that is given starting at age 9, usually age 11, but 9 through 26. So now we have a vaccine to prevent cancer of the cervix. So that's the importance of visiting Dr. Wood or any of us, because it's about the checkup, but it's about the vaccine to prevent cancer, which 30 years ago was unheard of.
And that you're talking about the HPV, which is the virus that begins that, right? Do you want to talk about that a little bit?
Yeah, so el VPH también, el virus de papiloma humano. Eso es un virus.
Say that again. Because you said it so fast, I was like,
Virus del
wait.
papiloma humano.
Más mexicana que nosotros, ¿no?
Es VPH, así se dice también. Es una infección, no hay síntomas también, okay. Y 80% de las mujeres y hombres lo tienen en su vida, que es muy común, okay. Y los hombres no tienen síntomas y no hacemos ninguna prueba para ver si los hombres lo tienen, okay. So, si tienes
tener cuidado si eres un hombre, entonces.
Pero no, es difícil tener cuidado porque no sabemos quién lo tiene. No sabe quién lo tiene. Okay.
Entonces que tengan cuidado todo el tiempo, ¿no?
O sea, pues el virus, lo que es importante saber del virus, okay. El virus, la mayoría de la gente se curan así solitos, okay. So we call it viral clearance. The virus is cleared from their system. Okay. But there's a small percentage where it doesn't get cleared from the system and it essentially stays dormant or even active, silently working, and causing problems and changes. The one that people notice, el síntoma que people notice are warts, okay? Pero hay diferentes tipos del virus, okay? Y unos causan los warts y otros causan cambios en las células del cuello de la matriz. Okay. Se desarrollan las células en con tiempo. Esos cambios pueden causar cáncer. Es un cáncer que tome años para llegar, okay, like 10, 15 years, okay. And so eso es porque tenemos el Papa Nicolau, or Pap smear. So the Pap smear is there to see, do you have any changes to your cervix caused by the virus? And we also test in some cases for the virus itself, okay. And that's different from a pelvic exam. Many people are like, oh, I had my Pap smear. They had a pelvic exam, that's different. Pelvic exam is just an exam of that part. Everyone's kind of doesn't really like to talk about too much, right? But a Pap smear is actually testing specifically for changes to the cervix caused by HPV infection, okay? And the infection, once you have it, and once you have detectable, is essentially the test is positive for HPV, there's no cure for the infection itself, okay? There's only prevention, like Dr. Pereira was telling us. It's the HPV vaccine. It's the only thing we have to prevent you from ever getting it, and from women having to suffer from it, and even from men, like I said, in the form of genital warts, for example. HPV vaccine is something that I recommend for all my patients, everybody.
No, this is actually something that I'd like to address.
Yeah.
Also, and that's, pues nadie planea en tener esas cosas, ¿no? Mm-hmm. Nobody plans on having these issues. Mm-hmm. And the parents certainly don't plan on their children having these mm-hmm. issues. And in a lot of cases, parents refuse to talk to their children about this kind of issue, right? So what you guys are saying right now is, it doesn't matter what you plan for, just protect yourself. basically, correct?
And protect your children too.
Protect your children.
Yeah. The HPV vaccine is a wonderful vaccine. It's absolutely wonderful. There are if I told you I could create a vaccine to stop cancer, most people are like, yeah, that's great. We've done it.
There it is.
When I say we, I mean like, not me.
Not you personally, but
but we have a vaccine that can cure, like prevents cancer.
of course.
And for those of you, I'm a little nerdy sometimes. There are some studies in Australia. It's mandatory. All school-age children have to have the HPV vaccine.
Interesting.
They're seeing decreasing rates of HPV infections, decreasing rates of genital warts, and also decreasing rates of cervical cancer.
Wow.
Okay, and it's amazing. And the thing is, you can do everything right, and there's always a stigma attached to, I have HPV. What did I do wrong? You can do everything right.
Yeah.
You can use protection. You can wait till you're married. You can do all the things that we're taught are the right things to do. And I'm not saying that those are the only way to proceed your life, but people are like, I did everything right. Why did I get it? It's because it's 80% of the people have it and they don't know they have it, and it's not fair. I think for people for anyone to get a cancer
that could have been prevented.
That could be prevented.
Of course not. Absolutely.
And the HPV vaccine is something that, starting at age 9, like Dr. Pereira said, is when you can receive it. But we usually recommend starting at age 11. The earlier you start, the less shots you need. So there's always a plus between two versus 3 shots over the course of time. And it protects against the nine major strains of HPV. And
9 strains.
9 strains currently. It's a 9-valent. 9-valent is a fancy way of saying 9 different types of HPV. Some of those are ones that cause warts. Some of those are ones that cause cervical cancer. And there's a difference. Una diferencia. So you can have, someone's like, already have genital warts. Get the vaccine, because you could still get all the other types, So I do recommend that the vaccine, even people who had HPV, you don't know which one you've had.
Yeah.
So it protects against 9 of them, and I think it's a really great vaccine.
There's nothing wrong with covering your bases.
No, it's great.
So that's the right thing to do.
Yeah. And I even tell people who are 22, 23, you're going off to college, you ask your parents if you got it. It's not something that's mandatory, so it's not something that our patients know. It's not like they had to have had it. Some of them have, some of them haven't. So ask your parents if you have it. If you don't, come make an appointment. We'll give you the vaccine. We'll start the series.
Great.
So it's really important.
Very, very cool.
Generally, it's best to get the vaccine before they become sexually active.
Yeah, I imagine.
So that's, even if you started, that's okay. We'll do it, but it's best if we can do the vaccine before that having sex.
Yeah, I imagine so, for sure. All right, so I mean, we've covered sex quite a bit. I mean, there's so much more that you can talk about when it comes to sex, of course. But there's a lot of other services that you guys offer, and let's talk about you guys offer some in-clinic surgical services, right?
Yep. So we talked about birth control. So ponemos el dispositivo que se pone en la matriz, so the IUD.
Now I've seen a new one that you can actually be put in the arm.
Hay uno que se pone en el brazo. There's one that goes in your arm as well. We also do colposcopies, which is a fancy way of saying we look at the cervix to make sure there's no problems with the cervix. If you've had an abnormal pap smear, si tienes como un pollo, like a boil or infection, we do INDs, which means we can, if you have like an infectious like boil, we can cut it open, clean it out, drain it, and treat that as well. We do ultrasounds in our office. We do ultrasounds for, like I said, pregnancy dating. We also do some gynecologic ultrasounds as well. We have a lot of services also that, in general, we can do a Mariposa. So we have ultrasounds available, high-level ultrasounds done by more specialized physicians. We have radiology. We have mammograms. I mean, we kind of just the whole gamut.
I was going to come up to the mammograms next, but since you covered them, you guys do mammograms. You guys do more than just the sexual reproduction organs. You guys cover the other organs as well, right?
Yeah. And we also, like Dr. Witter said, we also work with a specialized group who can help us manage pregnancies of high risk.
Oh, great.
So they come to one of our sites. They do the consultations. They do usually a different kind of ultrasound to look at the baby in more detail. So we do that so that the patient doesn't have to go to Tucson for routine care.
Yeah,
That's
of course,
something
of
we
course.
wanted to do for a long time.
Do you guys do the 3D one?
They have the group that comes down.
They have one of those
they
3D
have the
ones?
ability to do 3D ultrasounds. Yes.
That's pretty cool. I didn't get one with my son, but I always thought it would have been cool.
Right. So we try to bring services so that patients can stay locally
Of course.
and get as much as they can. So I think high risk pregnancies is just
Is one of the major ones. And, that's something that we really brushed over was the actual pregnancy. We talked about a lot about preventative stuff. But if whether planned or unplanned, you guys offer a lot of services for once you're pregnant and you have to move through that process. You just mentioned high-risk pregnancies, which I'm not sure what percentage of high risk you guys have.
Like 10%.
10%?
10% high risk pregnancies.
That's good, I hope.
I think it's probably pretty normal.
Normal.
What you'd expect, about 10%.
Okay.
Yeah.
All right. And so what do you guys do? I mean, walking through the trimesters and everything like that. How does that?
Yeah, so first trimester, it's kind of everyone comes in for blood work, ultrasound. It's really kind of you just wait to get through the first trimester. Handle the most common problems: nausea, vomiting, and pregnancy. Number one problem is nausea, vomiting, and so we have.
I remember when my wife was pregnant. It was bad.
It's pretty rough, yeah. Second trimester is almost cruise control. We just kind of check in every 4 weeks, make sure everyone's doing okay. Right at the end of the second trimester, there's some tests that we recommend to test for diabetes in pregnancy. We also make sure that our patients don't have anemia, make sure they don't need any additional services. And then the third trimester is when things get a little more interesting. We follow our patients, make sure the baby's growing appropriately. Oh, I forgot to mention, second trimester, they give us an ultrasound. Okay. The baby is checked for any problems. Specifically, we look at all the organs, okay? So todos los órganos, el cerebro, el corazón, they look at el hígado, they look at the riñones, la vejiga, todo. They look
Of course,
at
I
the
mean,
extremities.
building a baby inside
Yeah.
you causes some strain to your body, I
And
imagine.
what everyone wants to know, what's between the legs, a boy or girl?
Oh, of
So,
course, right?
yeah.
Of course.
So find out if it's a boy or girl. So that's the
So-
exciting thing about the second trimester.
Al caso, ¿no?
Yeah.
Que no quieren saber.
Yeah.
Do you guys set up
Yeah.
anything special with
Yeah,
the families?
so we've been, muchos quieren a gender reveal party.
Yeah.
Okay?
It's
And
big
so,
now. But gender reveal parties are a big thing.
If we do testing if we find out what's a boy or girl and you don't want to know, we just write it down, put it in an envelope, seal it, hand it to the patient, and
They do whatever. They can take it
They
and
can do
run
what
with
they
it.
want, whether they can hand it to a friend, a sweater, anybody, right? And
No,
then they
of
open it
course.
up, check it out, and then
Yeah.
they see if it's a boy or girl. Most people are happy.
I couldn't wait. I had to know right away. I
Yeah,
did
yeah.
when my wife was pregnant with my son. I had Dr. Duran from I told him, no, let us know. I need to know right away.
Yeah.
And the first time my son, he wouldn't turn around. He wouldn't turn around the first.
see the
So
face, yeah.
so we had to schedule another
Uh-huh.
ultrasound just to find out what the gender was.
Cool.
Yeah.
And so third trimester, we kind of just talk about, what to expect in pregnancy. Some people with their first babies, what to expect in labor. How do you know you're in labor? Things like that. We do measurements of the belly to make sure the baby's growing appropriately. And then later on, we do another ultrasound, make sure baby's in the right position to be born. So
Of
head
course,
down,
yeah.
boca abajo, has to be ready to go.
Claro que sí.
And then the last thing we check too is a swab for just make sure that there's no infections that can cause any problems with the baby. And they show up when you go in labor.
Yeah, well, let's talk about the magic moment right there.
Or it's a C-section. If it's time for a repeat C-section, we schedule that. So yeah.
Well, and we'll talk about that magic moment when
Yeah.
the baby's born. I
Yeah.
mean, right now, like you're on call.
Yeah.
You're ready to go if
Yeah.
if something happens. You're ready to run to the
Ready to
hospital
run, yep. Mhm.
and help that family bring in their numerical.
It's exciting for everybody. I love it.
Yeah.
I think that you can never that joy that people will have on their face when their babies are born, that
Oh my gosh,
excitement.
yeah.
Even people with their second, third kid, it doesn't matter. It's new.
Oh,
It's
yeah,
a
of
brand new
course,
baby. It's
absolutely.
great. Yeah.
I remember when my son was the moment that he was born. The doctor pulled him out. He said he was huge, 14-inch head. And the doctor said, "Oh man, he's ready for college." And I looked at him, and it was this combination of just the purest joy. And the deepest fear,
Yeah.
but not fear of being a father, but fear of ruining his life.
And then we have something I think we don't talk about a lot. I call it some people call it the fourth trimester.
Uh-huh.
So postpartum. So after a mom delivers.
Of course.
We have lots of services we offer. Mariposa is really, we have a lot of great services, and one of them is WIC.
Oh, yes.
We
Absolutely.
have lactation consultations available. Las mamás que quieren alimentar con el pecho. If they have any problems, they can go to WIC for help there. And you don't have to actually have WIC to get help there with lactation consultants.
Oh, really? Okay,
Mhm.
great.
So I've sent patients there for help too. There's some things like postpartum depressions. Si uno se siente deprimida, you should also come and get some help. We have Practicamos Salud. They come for patients who are struggling, having a really hard time for any reason, social reasons, financial reasons. Like if they're really young, teenage pregnancies, there's a lot of support available, help with getting like car seats, help with getting cribs, things like that. And then moms themselves too, we need to just keep a really close eye on them after the babies are born, make sure they're healing well from their delivery, however they had their baby. And then we also offer, in our OBGYN and our pediatric department, we do circumcisions for the babies as well.
Great.
It's another procedure that we do there in the clinic for any boys that whose parents want circumcisions performed. We can do that there too.
Very cool. Does that cost to the family, or is that a free service?
I think it just depends on your insurance and things like that.
Okay,
So,
so the
yeah, it's a
insurance thing.
variable. It's a variable.
Wow.
So.
And for those who have no insurance, we have an eligibility department that looks at their income and family size, and we do have some
And expenses and stuff.
sliding fee discount program that can help with those costs as well.
Very, very cool. So there's no excuse.
Yeah, but there's always extenuating circumstances.
Oh, of course, absolutely.
And then birth control comes back down to birth control again.
Of
We
course.
recommend that people wait about at least a year before getting pregnant again. Sometimes longer if there was any complications during their pregnancy. And so we talk about birth control too.
Of course,
Yeah.
absolutely. That's important. My mom should have thought about that.
Uh-oh.
She
Uh-oh.
popped 3 out in the mid in a row.
So.
I mean, it's some really, really good things that you guys offer. Some great programs, some great services and it's a well-rounded program. I mean, you from beginning to post-birth, it's and all the way through a woman's life that you guys have available. Aside from this, you mentioned mammograms and other stuff like that. It goes beyond just the OBGYN services that you guys offer. Do you want to talk about a little bit about that? I mean, you mentioned mammograms. Do you want to go into a little bit more detail?
So, just to really quickly though, I don't do this by myself. Obviously, we have great administrative staff, great support staff. I work with 2 other OBGYNs, Dr. Steve Dudek and Dr. Nora Mustafa, and a great nurse practitioner, Emily Roth. And so we all kind of work together, and our medical assistants all work together to provide the care that our patients need. As far as the services, like I said before, we have the pap smears, and I don't think I was clear before, starting at age 21 is when we recommend it. It doesn't matter if you've been sexually active beforehand, 21 is when we recommend you start, up to age 65. Mammograms as early as age 40. Definitely recommend that initiate no later than age 50. And then we also, if you're there for your annual exam, we don't just, we do nutrition referrals, nutrition counseling, do referrals to gastroenterology, people who need colonoscopies, just regular preventative care. We do vaccines, and not just HPV vaccine, but we also do like the Tdap vaccine, the flu vaccine. And this is all in the OBGYN department. And there's way more that's offered, obviously, throughout the rest of Mariposa.
Oh, of course. Mariposa's it's such a well-rounded organization.
We help women who have irregular bleeding, irregular menses. We help women who have problems with urinary symptoms, especially as you get older. Women who've had lots of babies will have issues with their controlling their urine, unfortunately. But we have a lot of help with that. We have problems. People talk about prolapse, which is something that a lot of people aren't really familiar with. Unfortunately, our patients tell me, they come in and say, I feel something between my legs. What's that? Sometimes the uterus can fall out of the vagina. The bladder can fall out of the vagina. The rectum can fall out of the vagina. And it's called prolapse. And we have treatments for that we can, there are same-day treatments where we put, it's called a pesario pessary. We put it in the vagina. It's like a brace that holds everything up. And then there's surgical options as well. When things get really complicated, if we need to, we refer to Tucson. We have a lot of great connections in Tucson as well. And we help women with sort of all the different problems that they have, regarding that. But it's very variable. One thing that's really important, I always tell people, when should I come and see my doctor? When you're young, it's easy. Like I said, if you're sexually active. If you're not sexually active, at least 21 for your first pap smear. And we do recommend annual exams. not necessarily pap smears, but exams to make sure everything's going okay. And then pap smears up to age 65. And then after age 65, one thing people are like, well, I don't have what do I come to see my OBGYN for? Well, any bleeding ever after you've gone through menopause. So postmenopausal bleeding is one of the biggest reasons that people who are no longer having a menstrual cycle come in and see me, and it's the most important because that can be a sign of uterine cancer.
Oh my gosh.
And so postmenopausal bleeding is never normal for anybody, and so it always requires an extensive evaluation to make sure everything's okay. And then people who have any problems with pain, with sexual intercourse, things like that, who are older, and that's usually due to changes with the hormones as people get older. The hormones change, and then things just aren't the same. And there's so many different options and so much advice, things that we can do to help women through the kind of these things that people don't talk about.
And nobody talks about sexual activity once you're past a certain age.
No. Muchos de mis pacientes son muy sorprendidos cuando les pregunto, ¿tienes relaciones sexuales? Y me miran, ¿sí? No. ¿Qué debo decir? No sé. So it's okay, just be honest, you know. Whatever my patients are comfortable with is okay, you know. So yeah.
Very, very cool. So we're going to wrap it up real quick, but I want to leave you guys with a quick story from when my wife was pregnant. So my son, he was a big baby, right? A real big baby. And one time when my wife was working, she was just standing there, and all of a sudden she just kind of collapsed against the wall. Uh-huh. And it was because my son sat on her descending aorta. Yeah, he leaned on her descending aorta, cut off all the blood to the lower portion of her body, and she just collapsed. And as soon as she collapsed, he moved, and it came all back. But the ambulance that responded, they thought it was one of the most hilarious things they'd ever seen in their entire lives.
That's scary.
Yeah, it is scary, but it wasn't dangerous because he rolled off right away. You know, have you ever had anything interesting like that happen to a patient?
Well, I mean, so there's people can faint.
Of course.
In pregnancy también, you know. Skipping meals, being busy working really hard, you know, standing up really quickly. So if you're laying down, you stand up really quick. The circulation's a little different, and so patients will faint. I've definitely had patients come in like I fainted or I almost fainted, and that's pretty common. It's a little,
of course.
It's kind of similar to like the circulation problem. Sounds like
yeah, for sure.
But
you got an extra dietary intake. You got to take in extra calories to feed the second life growing in you, right?
Yeah. So our patients will like. I've had patients who's like I fainted, almost fainted, things like that.
Man.
So pretty similar.
Yeah, for sure.
But not as scary, I think, as that.
Sitting on the descending aorta for sure. Now, last thing before we go, do you have any advice for the fathers of expectant?
Yeah. So I'm a mom. I have 3 children.
All right.
Okay. My husband. I think that the best thing for this is a good one.
All right, this is
it's a great question though. One, if you can go to a prenatal visit once in a while, you know, meet your doctor.
I was at all of my wife's visits. I would not miss. I had to be informed. I had to know.
Sometimes it's not possible because of jobs and work. The other thing too is if some patients sometimes tell me, oh, my husband tells me I'm at home all the time, I don't work. You know, I should be, when you're pregnant, that's a job. So be very understanding of your wife or your partner. Help out too. Even if you are working a full-time job, it's helpful to kind of help around the house sometimes. Women are working hard, especially if you have other children too. It's a lot of work.
Oh, of course.
Back rubs, great. Okay, I have many a times I've written down recommend back rubs.
I want to warn men out there real quick because back rubs are a good thing, but sometimes your wife wants no physical contact whatsoever. My wife did not want any back rubs from me.
Or foot rubs.
Yeah. Okay. She didn't want those either, though. Okay. But those are good. I understand for a lot of.
They can be very good. So I always tell people, you know, do you have someone who can rub your back or rub your feet after a long day at work?
Of course,
it can be very helpful too. So yeah.
Great.
And just be understanding of the mood swings. That's kind of tricky, okay? Because the hormones are kind of going everywhere.
You've been on that side too.
Yes. You have to be understanding, okay? Course, it's not your fault. You didn't do anything wrong. It's just hard.
It'll pass. It'll pass.
Yeah.
For sure. And once the baby's born, help out as often as possible, for sure.
Help out as often as possible. Definitely encourage breastfeeding. It's one of the best ways to care for the baby. And mom's breastfeeding, that's a lot of work too.
Yeah.
And being really understanding that takes extra time and effort too for moms to breastfeed at home. Being supportive of that would be great too. Yeah.
Very, very cool. Thank you guys so much for coming out. You have one more thing to say?
Just a quick comment about postpartum depression.
Oh, great,
It's
yeah.
really important. I think some women get really depressed, and it could be a significant condition. So if the woman loses the joy and no desire to do pleasurable things and a depressed mood, it's really important to come and see us to make a diagnosis, because treatment is effective, and we've seen some issues with that. So I just want to make a comment about that postpartum depression.
That's great. I wanna say real quick, props to my wife. Because it's been 8 years since he was born, but it was right after my father passed away. I just mentioned this to you. My father passed away a month after my son was born.
Oh.
So I was the one going through depression. And I would stay up with him and I would help out with everything I can, but I was going through a really hard time. And she stepped up amazingly. It was hard, absolutely. But she handled it like a freaking champ. And thank you,
Yeah.
babe.
Thank you very much, Jeff, for having us. Yeah.
No, thank you guys so much. Thank you very, very much. I really, really appreciate it.
No, gracias. Thank you for inviting. We were happy to come back and talk about pediatrics and other topics. Our department is great. We have 3 doctors. And
There's a lot to talk about for sure.
We could spend 5 hours talking about
of course, we
medicine.
could.
Happy to do that. So
Very, very sure.
thank you for inviting us. Thank you to Dr. Witter for taking time to come in. And again, thank you very much.
I really, really appreciate it,
We'll
guys.
see you.
All right.
Thank you.
So
Thank you,
we may do, just a heads up, since we didn't cover any news topics today, there will probably be a special, a We Love Nogales special coming out later this week, where we'll talk about, obviously it's been 1 year since Officer Cordova was shot, and they just had a ceremony to commemorate that, and of course it's something that's always in our thoughts, and his family's always in our prayers. So we'll see you guys later. Also, Fiestas de Mayo van a celebrar ese fin de semana. Hay que, ¿no? Hay que. Carne asada, unos cheves. Muy bien. All right. We'll see you guys later.